Welcome, Dr. Laura Stark again.
Thanks.
Cancer Care Director at Clear Health Inn.
That's right.
So this coronavirus has been with us now for a while, and the lockdown, and you deal almost exclusively with people who have low immunity. In general, they have cancer, their immune system has been wiped out for whatever reason.
It's true.
Yeah, so with them, the fear and the worry must be even more amplified than what general public or the normal people kind of...
You'd kind of think so. Although the attitudes have really been quite awesome and uplifting in my patient population.
How so?
They actually have all the things that they need to do to keep themselves safe weren't new to them. They've all been commenting like, we already pay attention to like washing our hands and staying away from crowds and doing all those protective cleanliness kind of germ-free things, so because they know they're immunocompromised.
Yeah. So is this
is
this a case of so the general human population has no immunity to this virus because it's new to us. It's new to the species.
Right.
So we feel like we're immunocompromised in a way when we're dealing with it, right? Whereas the patient population you're talking about has always had that issue.
Yeah, not always, but since their diagnosis or since their condition, yeah, all the same rules are just still applying to them. It's not really that new. And I think the other attitude adjustment is they have a serious illness and they've already faced their mortality and go, really? Just one more germ to deal with? Nah.
Yeah.
This isn't so big a deal.
Yeah. Yeah.
So they have really positive attitudes around the whole thing and are still just keeping themselves safe the way they always do.
Yeah. So are they then just following the normal precautions they've always followed, plus whatever social distancing and whatever's been mandated? Is that all they've been doing? Nothing more?
Yeah, pretty much. Well, and the neat thing is too, for lots in our cancer population, the treatments that they're continuing to get treat exactly the things that we would to help them be more resilient to a virus anyway. So very often their high dose vitamin C that they're getting for as an anti-cancer treatment is also a great antiviral booster. We use it in that population as well. IV ozone treatments, those as well are awesome antimicrobial immune boosting treatments that we use to say boost immunity when they have like low neutrophils or low lymphocytes from chemotherapy. We use that to boost, but it's also a very effective antimicrobial agent. So they also feel like they're already doing some super big gun therapies to protect themselves as well from a viral threat.
So is there anything that the rest of us can learn from them then? If they've already been dealing with this for a while, or are we already doing whatever needs to be done?
Right, it is kind of interesting. Even like through normal flu season, when I reflect on seeing my populations of cancer patients and taking their normal precautions, they don't seem to pass things around the way we often see or would assume, right? These people are, say, coming together in the IV room twice a week and always seeing each other, and maybe someone in their family has a flu and, flu season goes around. We never see it get passed around this group of people, which is kind of interesting.
Okay, so the population of patients that you deal with are ones that have cancer, are immunocompromised, and they are looking for other things beside traditional medicine to kind of strengthen their own immune system. So because they've self-selected themselves when they're coming to you.
Correct.
So they're into vitamins, so what I mean is the rest of the population, who's been going about their lives are social distancing and doing all of that, but they're not necessarily thinking about how do they strengthen their own immune system now. Is that what we could learn from these people?
That's a wonderful thing that we could learn from them, absolutely. Exactly. My cancer patients probably maybe aren't so scared because they are taking so many proactive actions for themselves. Like they're in the control seat of their health, all of my patients. And we just have a selection bias towards that because these are people who are empowered to do their own research, figure out what they need and get it for themselves. Whereas a lot of people don't have those motivations. They just want to be taken care of externally, which, well, what's that adage? Like your best defense is a good offense. Acting proactively to have a healthy body is probably the wisest thing we can do, right? This is a novel virus. We don't know. We're slowly gaining research as to some things that can be helpful, but we don't have a body of research to confirm, what works, what doesn't work against this. But generally, the healthier you are, the less susceptible you are. That's always a rule of thumb, and we're seeing that in terms of the people who are most threatened and most subject to the ill effects of this virus are compromised from another condition.
Yeah, so I was going to say what we do know about this virus, even though it's new, is that those who are immunocompromised or have an immune system that isn't functioning as well are the ones that are actually getting very seriously ill from it and dying from it too.
Exactly.
So then the lesson is how do we optimize our immune system so that
our strongest.
Yeah, so that when we do get it, we don't suffer as much from it.
Precisely. We have the resilience to get through it, gain the immune integrity, and carry that through the population. Right?
Yeah. So some of the things you mentioned is let's just do very generally. So they take vitamins, they take some other
pay attention to their diet.
Yeah, okay.
Like even those foundational things of getting adequate sleep. There's actually kind of a neat one. I've come across a few pieces of research and some of the ideas of why children are having less susceptibility to this virus. And in general, is that they have higher melatonin levels. They're not so affected by, say, screen time as we are always on our phones with our blue lights, etc.
So that suppresses melatonin, doesn't it?
Yes, it does. Exactly.
So that's why people who are on their phones a lot have trouble sleeping, and that's why they say don't look at your device right when you're about to go to bed, or ideally a couple of hours
into the evening. Yeah, melatonin, as it turns out, is an awesome brain antioxidant, just antioxidant in general, but is also a powerful antioxidant even in the lungs. And low melatonin levels seem to be correlated to a worse prognosis with this virus, and maybe explains why children are being less susceptible to it, because they, in general, have higher melatonin levels than we do, right? They sleep like 12 hours overnight, a toddler does, and we sleep less and less, correlating with lower melatonin levels. And melatonin happens to be a high-dose nutrient we often use in cancer patients. It has a magical way of lowering the ability of tumors to spread through angiogenesis, to spread just simply through metastasis. It has a whole bunch of cancer control mechanisms. So that's a supplement they're often on for their cancer. It might also be protective from this antiviral perspective. Maybe. Interesting.
I mentioned vitamin C, and what about vitamin D and other things, zinc?
Mm-hmm. All those basic immune support nutrients, A, C, E, selenium, zinc. Again, very often a foundational part of cancer support because we're supporting the immune system for that same reason. So yes, all of those in basic, they're all frontline boosters we can use when we're feeling a threat to our immune system to help elevate immune function acutely, and keep immune competence over time as well.
One thing that troubles me in particular about this is the levels of fear and anxiety in the general public and how we see that manifesting in the supermarkets.
My gosh.
So that adrenaline must also suppress the immune system.
Huge. For me, I think the biggest factor, honestly, in terms of the danger of this virus is the fear factor. Acute fear absolutely compromises our immune system through activating all of our stress systems. We understand the physiology behind that. No use going into details here, but we know those negative emotions compromise our physiological function. And if we're in this constant state of flight or fight, we are not accessing any of our healing, rest, recovery modes. Then our digestion is compromised, then our absorption of nutrients is compromised, and these things snowball, and we don't sleep as well. So we wind up getting this compounding of issues compromising our resiliency. So we become more and more susceptible. And from even another perspective, that fear can actually be seen as the most contagious thing, actually, and the thing that spreads the contagion itself.
Yeah. Yeah. But the issue is with so many people having so much time at home, watching more of the news, either online or through TV, and basically interacting in social media, watching other people freaking out about it. Is there a practical way to just kind of get out of that? I mean, I think,
Turn it off.
well, with your patients,
Go for a walk.
they've dealt with that. They're probably not as fearful because they've prepared.
It's
Right?
true.
Is that like a main thing? If somebody feels that, okay, I'm doing some things, I'm being proactive, not only am I helping my immune system, but now I'm in a better,
Yeah,
they
you're
won't be
right.
as
They
afraid.
have this strong locus of control there versus someone who isn't very well educated about what they can do for themselves, right? Doesn't have that locus of control, who is just told to, sequester themselves. And now we have the social isolation that adds to anxieties, right? We're social creatures. We need the support of our communities. And so that's really trying on a lot of people's psychology, a lot. So unless you're proactively thinking of ways to keep yourself connected, and kind of keep that emotional resiliency up, it can be a huge struggle. But yeah, I think a big piece there is not having the understanding of what you can do proactively. Having a plan and having things to do kind of tricks us into thinking that we have control over the situation. And I say it tricks us into thinking we have control because the reality is we never really have control. But when we trick our mind into thinking we have control by having actions to take and things to do and understanding what the consequences of those might be, it really helps to settle our minds. Simply having a plan to get through really does work wonders. And that probably is a commonality with all of my patients too. They have their plan in place. They know what they're doing to look after themselves. And so they feel quite safe because of that. But without a plan and compounded with isolation and just messages of fear and keeping yourself isolated, that's a snowball of anxiety just building and building. There's just so many unknowns with this virus that it's hard to have a plan.
Yeah.
You have to take a further step back.
Great. So any maybe final advice, you can give us the top 3 things you tell the average person to do now.
Well, the big flashy number 1 is find your ways to subdue the fear. You have to stop watching the news, whatever it is, connect with the people you care with, even if it's through a distance. Stop getting those messages and, well, hear the message that your body knows what it's doing. Even with a novel virus it's never seen before, trust in your body's ability to heal itself. Right? That's kind of always a foundational message that I rest in, and that I hope I can inspire my patients to rest in as well. And then the practical aspects, follow the instructions of the health authorities and, do your social distancing, wash your hands. Forget about all the hand sanitizer unless you don't have hand washing available, right? But wash your hands, gargle. Gargling can be even more effective for respiratory illness than washing hands, even just with water. So every time you brush your teeth, gargle, rinse off those mucous membranes.
How about with salt?
Sure,
Yeah.
Salt can up the ante. Or even the original flavored brown Listerine is essential oils. That stuff's badass. It will kill anything. But simple water gargling is even good enough. Or even castor oil. There's an awesome thing to gargle with to cleanse out your mucous membranes. So washing, keeping the social distancing, doing all those precautionary things that we've been instructed to. And what would I say is a third? Well, think about how you can make yourself more resilient. So that big, broad background, you know, are you at home binging Netflix and junk food? Or are you, you know, taking the time you have to make home cooked meals? Maybe experimenting with new recipes, eating your whole foods, getting your rest, prioritizing self-care so that you are really looking after yourself to be a stronger version of yourself and a more resilient one.
All right. On that very positive note, I think we'll end this. Thank you very much. Appreciate you giving us the time.
Absolutely.